I'm Austin Hayes, and thank you for scheduling your consult. This video is meant to be an intro to the procedures that you've been thinking about. Hopefully I'll give you some new information. Go ahead and write your questions down, bring them with you to the clinic, and we'll discuss each question that you have when I see you. I'm gonna talk about tummy tuck procedures. I get a lot of inquiries for this operation. Usually it's to remove extra skin and tighten the muscle on somebody's abdomen who may have lost weight, noticed changes with aging, or most commonly have had children. For people to get prepared for a tummy tuck in the most optimal way, they need to reach their goal body composition. It's typically described as weight, but it's not really that. It's getting the blend of kind of your percent body fat and muscle where you like it, and that's the optimum time to do a tummy tuck operation. A tummy tuck uses a low incision, which I like to put beneath somebody's bikini or underwear line. What I do is I actually tailor the ends of the incision to go exactly how somebody likes to wear their clothing. So sometimes it'll go a little higher or a little flatter, and that's just based on your preference. I then lift up the skin, tighten the muscle as tight as it will go. Most people who have had children have a stretched abdominal wall. It's described as a rectus diastasis, which is basically, it's a separation between the muscles, and people will come in and say that they have a gap between their muscles and they've noticed that. One way to test for that at home is relax your abdomen all the way, see if it bulges out. Many people notice that they bulge a lot more now than before they had kids. So I want to repair that, and I do that all the way from the ribs all the way down to your pubic bone. So really it's like an internal corset. Now that I've already lifted up the skin, I can then pull it down and remove the excess. My goal is to get out most of the skin between your belly button and that lower incision that I've made in your bikini line. The operation's done under general anesthesia. One of the things I do is I use a long-lasting numbing medicine. It's called Exparel, lasts for about 48 to 72 hours, and I inject it in the muscle and also all around the incision. So people have a lot less pain, particularly in those first 2 to 3 days. I give people pain medicine. Usually they take that for 3 to 5 days, although I have had patients take very little. Some patients have taken zero pain medicine except for Tylenol and ibuprofen, but most people are gonna take pain medicine for a few days. Other things on the recovery, I like to describe the recovery in 3 phases. So phase 1 is where you need somebody to take care of you. And typically that phase lasts about 5 to 7 days. Phase 2 is where you can care for yourself, but you're not really responsible for caring for anybody else. So for people who have a family, you're not caring for children, you're not running kids to errands and that sort of thing. Really just responsible for yourself. And that goes out to week 2. Week 2, people are feeling really good. You're starting to walk more upright. You're mobile the whole time, but being upright is really kind of a big step in your recovery. I'm not letting you work out though. Working out, lifting heavy, those are 6-week activities. So, the main question is, when am I fully healed? It's 6 weeks, but you're feeling pretty good at week 3. Work really depends when people return to work. Many people who have a desk job, they're back after about 2 weeks. If people have a little bit more flexibility, they might push it into 2.5, 3 weeks, that sort of thing. So we can talk about that in the office, talk about all your specific activities and when you can get back to things. So I look forward to seeing you again. Write your questions down, and thank you.